older, you know what they say, the eyes are the first to go. Whether it's near or far, no one likes to live with blurry vision. Here to clear up the fog, welcome ophthalmologist Dr. Colby Stewart. Good morning.
Thank you, Deborah.
Okay, so blade-free LASIK. There are still some people out there who are confused, thinking that there's a blade involved in this LASIK surgery.
Well, when LASIK first started, when I first started doing it 15 years ago, there was a blade to make the little flap in the cornea. And we had good results with that. But if you were going to have a complication with LASIK, it was going to happen during the creation of the flap. And now for the last 7, 8 years, we've been using laser. So really, really accurate laser to help make that flap so it decreases the chance of anything.
Yeah, in fact, we're taking a look at some video right here. So the patient lays down, it's nice and comfortable, and so there it is right there. And I remember when I had it done years ago, it just took a matter of seconds, and I felt nothing. And it was amazing what happened after that. So it could correct nearsightedness, farsightedness, and astigmatism, because a lot of people think if they have astigmatism, they can't get it done.
That's right. Almost everybody that doesn't know much about the industry and what I do, they always ask, oh, I want to have that done, but I have astigmatism. I said, well, we've always been able to get astigmatism. And astigmatism is just another thing like nearsightedness or farsightedness that keeps you from seeing your best. So you can correct it with contact or glasses, or now even have LASIK to have it removed so you can see your best without any correction.
Yeah, and we say see your best. Most patients see 20/20 or better. I know I was 20/15. I think a lot of us think that 20/20 is the perfect vision, but really it's closer to 20/15.
Well, a lot of it depends on how well you can see before you have the procedure. So some people may have one eye that's a little weaker, even with the right pair of contacts. Let's say if someone's best vision is 20/25, which is good. If you have LASIK, then we're going for 20/25. We can't make an eye see better than it can only see even when it has the glasses or contact on.
All right. So the LASIK process, the first thing you can handle is the patient's nerves, because a lot of people still, this is these are my eyes, but this is a safe procedure.
Right. And I mean, obviously, anybody that's thinking about having LASIK, they're very nervous about anything that has to do with their eyes. So I tell them two real big things. One of them is when you come, you're going to get some Valium, so you're relaxed, you're not nervous, takes the edge off. And two, I tell the patient you can't do anything to mess it up.
Yeah, because people say, what if I blink?
That's big. Already, obviously, they're there, they're sitting in the relaxation room, they're ready to have it, and they trust me. But what they're thinking in their mind is, what if I move? You know, what if I cough? You know, all those things we have already thought of, and we have ways to make sure that doesn't happen.
Okay, who actually can qualify for LASIK?
Well, you know, anybody that has nearsightedness, farsightedness, astigmatism, up to a degree. Now, we have some people that are really, really nearsighted, really farsighted, or have a whole lot of astigmatism. They don't qualify.
Yeah.
You know,
or
you have
18
to be
and older.
18 or older. You know, we obviously don't want anyone that's pregnant because of the liability there, and it's also if you're nursing afterwards. I just the gold standard is to wait till all that stuff is over before you can have LASIK.
Yeah. Okay. So getting out of reading glasses, that's another thing that's kind of a not if but when for a lot of us, and so LASIK can be used for that as well.
That's right. And what happens is when we become 40, we start holding stuff out. And
yeah.
And so we see, especially.
You're getting an amen from some of the audience members here. Yeah.
I mean, especially.
But y'all aren't past 40. I'm sorry. Right. Yeah.
I mean, especially people, because I'm at that age where I'm pushing stuff out, and all my friends are coming for me for their LASIK. So they want it all. They want to be able to fix this and fix their distance vision. There's really hard to do. So what we do is we do what's called monovision or blended visions. We take their dominant eye, usually if they're right-handed, it's their right eye. We set their right eye up for distance, so perfect. And the other eye, we set the focal point to about right here. And it sounds crazy. And everyone's like, well, I'll be crooked. Yeah, I'll be crooked. I'll feel drunk when I'm walking around. And that's not the way it is. Your brain can adjust to it, and you can get out of both the reading and distance glasses.
All right. The other thing that happens oftentimes with age is cataracts. But there's a difference between cataract surgery and LASIK surgery.
Right. Well, with LASIK, we're making people see better without their glasses and contacts, so it's more of a cosmetic procedure. Cataract surgery, cataract is a haziness of the lens inside the eye that keeps people, it doesn't matter what pair of glasses or contacts you put in, you have to go in the eye to remove that hazy lens, and then we replace it with a clear lens. We also use a laser for that too, but it's a different type of laser.
We were talking about earlier about going to someone who knows experience. This is kind of in your DNA.
Right, yeah. My father was one of the original founders of Houston Eye Associates. Now we're one of the biggest groups in the country. So I've been around it my whole life. So.
All right, I just want to start singing the song. I can see clearly now, the rain is gone. Thank you very much. Dr. Stewart has a special offer for Great Day viewers, $1,000 off blade-free LASIK for the first 100 callers. This includes the visit, the procedure, the post-operative care, and enhancements. To get in on this special, call 713-358-4340, 713-358-4340, and you can learn more about Dr. Stewart and LASIK at stewartlasik.com. Well, tomorrow's National